Hi, and welcome to today's webinar on HIPAA compliance for group health plans. My name is Corey Jorban, and I'm the Chief Compliance Officer for Hub's West Region. I'm joined today by my colleagues Lisa Burkhart and Sonya Gordon. So today we're going to talk about the HIPAA basics of those foundational principles. Then we'll go into the privacy and security standards, and then finally we'll wrap up with the HITECH Act. With that, let's jump right into the foundational principles. So first and foremost, as with any government requirement, there are potential penalties on the table for non-compliance. As you can see here, these potential penalties can be quite substantial. Also, as you can see, the penalties really depend on the category of the violation. Did the employer not know about the error, or was there potentially willful neglect that was corrected or not corrected? As you can see, the level of culpability ultimately then relates to the potential penalties on the table. So HIPAA was first enacted in 1996, and as with any other body of legislation, it has just continued to evolve since then. We've seen a number of changes since it was first enacted, and we will continue to see changes as well. HIPAA enforcement is governed by the Office of Civil Rights Division of the Department of Health and Human Services. Obviously, this is a major part of health plan regulation, as well as regulation of medical providers. So what does HIPAA actually do? This is a really good question, just because oftentimes people say HIPAA without actually knowing what it truly does. So it requires the protection of certain information. That information is going to be the protected health information, which we're going to talk about in a second, and then also prevents the unauthorized use and disclosure of that protected health information. Essentially, individuals have this protected health information, and HIPAA governs what needs to be done with that information, the rights of the individual to protect that information, as well as what responsibilities of those holding that information have to protect that information and keep it secure. So what is actually protected by HIPAA? This comes down to PHI, or protected health information. I personally really like the equation down at the bottom, because we have to have the health information plus the individually identifiable information as well. The example I like to give is if I took a piece of paper and just wrote down broken leg. That obviously has health information, but it does not have anything individually identifiable. If I added something individually identifiable, now all of a sudden I would have that health information plus the individually identifiable information equals protected health information, or PHI. This also highlights the fact that there is a lot of other sensitive information out there. You might have heard about the variety of different breaches that have happened in the retail world, and as part of this, most of those don't involve PHI, or protected health information. Instead, they involve PII, or personally identifiable information. This information is often governed by state law, and there are protections in place. However, it is not subject to HIPAA without it actually being the PHI, or protected health information. Here we have an example of all the different potentially individually identifiable information that can be out there. Of course, we have names, addresses, and social security numbers, but then we also have less common items such as account numbers, or medical record numbers, or even telephone numbers. Essentially anything that can ultimately be tied back to an individual could be that nexus between the health information and the PHI, or protected health information. So in terms of who needs to comply with HIPAA, this applies to covered entities. As you can see here, we have a number of different categories of who falls into covered entities. So over on the left, we have the healthcare providers. So this is going to be the doctors, the nurses, pharmacies, any type of healthcare providers. What we're most concerned about here are going to be those health plans in the middle. So essentially those employer group health plans. Finally, over on the right, we have the healthcare clearinghouses. But again, our focus here is going to strictly be on the employer group health plans. So the other group that needs to comply are going to be those business associates. So those are going to be those third-party vendors that create, receive, maintain, or transmit PHI on behalf of the covered entity. So we have a number of those listed here. We have the third-party administrators, insurance brokers, actuaries or accountants that perform services for the plan. We also have asset recyclers. This is one of my favorite categories to point out, because if you have an office where there is a recycle bin and you have a third party come and take those recycle bins off site, there could potentially be PHI or protected health information in those recycle bins. So therefore, those asset recyclers are going to be considered business associates. Who is not considered are going to be those common carriers such as the US Postal Service, UPS, or Federal Express. Obviously, if you are giving them a sealed envelope, the expectation is that they are not going to then open that envelope and look at it, even though it might contain PHI. Whereas with those asset recyclers, remember, it is their job to actually open those recycle bins so that those assets in that bin can ultimately be recycled. So in terms of the covered health plans, not every single health plan is actually going to be subject to HIPAA. However, most of them will be. As you can see from this list here, we have the medical plan, the prescription drug plan. We also have dental and vision plans and wellness programs too. All of these are potentially subject to HIPAA. Also, it's interesting to point out that we have Section 125 and cafeteria plans listed here. So remember, cafeteria plans are what allow for those pre-tax deductions. FSAs or flexible spending accounts are included in Section 125. So even though the Section 125 plan itself is not going to be subject to HIPAA, if you have an FSA, that is going to be subject to HIPAA, as well as the benefits that you offer within a cafeteria plan, such as a medical plan or a dental plan. Now, there are going to be some types of plans that are exempt from HIPAA. So first at the top, we have those very small health plans that are both less than 50 participants and are self-insured and self-administered. This is incredibly uncommon. While we do have employers who we work with that are under 50 and are self-insured, very, very few of them are actually going to also be self-administered. Instead, those groups would instead use a TPA or third-party administrator, which then would subject the plan to HIPAA. Finally, down at the bottom, we have the list of accepted benefits. So these are going to be benefits which are accepted from HIPAA requirements, including life insurance, workers' compensation, disability, automobile insurance, as well as stop-loss insurance. What I do want to point out here is that a lot of times the information related to, say, a life insurance claim or a disability claim could potentially be PHI or protected health information in the hands of the health plan. However, as that information relates to these accepted benefit plans, that information is still not considered PHI and is not subject to HIPAA. That being said, it is still very, very sensitive information and is often going to be protected by other laws. So what I always like to point out is that even if HIPAA does not apply, that does not make the information any less sensitive. So in terms of determining what our HIPAA compliance obligations are, here are some key considerations. So first, how is the plan funded? Self-insured plans by nature have more access to PHI than fully insured plans. To that point, even fully insured plans below a certain size might not have access to any protected health information. Next, does the plan have access to PHI or is access restricted? One thing I always like to point out here is that even though the plan may not regularly receive PHI, that is different than the plan being restricted from accessing PHI. For example, I know several employers that don't regularly receive PHI, however, they can receive it if they specifically ask for it. This is really designed by them to limit their exposure, because the less PHI they have, the lower the risk for them. And then also down at the bottom, I just want to point out, if there are business associates, you need to make sure that you do have business associate agreements in place. Sonya is going to talk more about this in detail later on, but this is a key part of overall HIPAA compliance obligations. With that, I'm going to turn it over to Lisa, who's going to talk about the privacy and security standards.
All right, well, as Corey mentioned, when we think of HIPAA, we often don't realize that there are two sides to the HIPAA coin. Go ahead and give us that next slide, Corey, and let's look at those two sides. Just for the fun of it, I'll say privacy is heads and security is tails, for example. A lot of us don't think of the security side of things, but HIPAA privacy deals with what we do with protected information, how we use it, and if and when it can be divulged, and in what instances it's okay to divulge it. The security side of the coin is the one we don't think of as often. This deals with how we safeguard protected health information, or PHI, when it comes under our control, such as in our computer systems, or in our email, our voicemail, and in our laptops and our file cabinets. This includes ensuring no one gains access to it without the proper need or authorization. Over the next several slides, we'll look at the various components of a privacy program, which include an overall privacy policy and audit procedures, a privacy notice outlining how you agree to handle PHI, disclosure rules, and the handling of authorizations for disclosures, and last, but certainly not least, the protocols for how to respond to privacy breaches. The privacy policy and procedures is your written roadmap for how you'll handle protected health information, and applies to those involved in creating, receiving, or using PHI within your group health plan. It should outline under what circumstances PHI is routinely used, which includes, as Corey mentioned, for treatment, payment, or healthcare operations, and should provide for individual rights to designate or limit who sees and uses their PHI. Additionally, individuals should have a right to get an accounting of any PHI disclosures outside of that typical treatment, payment, or healthcare operations reasons. We'll also talk a bit later about the concept of using the minimum necessary PHI to accomplish your needs. All right, let's go on to the next slide. The notice of privacy practices is another main component of your privacy program. It serves as a written notice to plan participants of their rights and the plan's disclosure policies. This notice must be given to all new plan participants at the time of enrollment and to any participant upon request. In addition, at least once every 3 years, a health plan must notify all plan participants that the notice of privacy practices is available and explain how to obtain the notice. This is frequently done and distributed to plan enrollees under the same conditions as annual and new hire required notices and other plan documents. If your plan is fully insured, this notice is the responsibility of the insurer and is typically part of the insurer's certificate of coverage. If, on the other hand, you're a self-insured plan sponsor and you maintain an online benefits portal, you'll need to post this document with your other plan documents following your usual plan document distribution process. We heard Corey describe the concept of covered entities earlier. The administrative requirements of the HIPAA privacy rule apply to covered entities. Here is where we'd like to point out an important distinction. Group health plans are considered covered entities. Employers are not covered entities under HIPAA. However, because employers as plan sponsors are involved in the operation of the group health plan and have access to PHI, the employer as plan sponsor can become responsible for some specific HIPAA requirements. A plan sponsor's degree of privacy responsibility is directly related to whether or not the plan sponsor will receive PHI, Protected Health Information, or SHI. Corey, can you go to the next? There you go. SHI is summary health information. PHI can be disclosed to the plan sponsor only under specific conditions, including the certification that it meets an extensive list of requirements that includes adequate separation between the plan and plan sponsor, that the PHI it receives will be used for plan administration purposes only, and very important, that it will not be used for employment purposes. Okay, let's go to the next slide. Some permissible ways to disclose PHI to the plan sponsor is to de-identify the information, which involves the removal of all individually identifiable information, or obtain authorization from the person or persons whose information will be disclosed, of course, in compliance with the HIPAA authorization rules, which we'll go over in a bit. Or, alternatively, use summary health information, which is a subset of PHI from which individually identifiable information has been completely excluded. Such summary health information can only be used for health insurance bids or for plan-related activities such as modifying, amending, or terminating the plan. Corey also touched on this earlier. Group health plans can use and disclose participant PHI for the purpose of treatment, payment, and healthcare operations, or TPO. Examples of treatment, payment, and healthcare operations are seen here on slide 24. For any reason that is not considered for treatment, payment, and healthcare operations, an explicit authorization from the affected plan participant must be received. Examples of when an authorization from a plan participant must be received for PHI disclosures are when adding benefits, putting in any kind of new coverage, or when marketing for new products or services. An authorization can either be conditional, meaning that a group health plan can condition enrollment or eligibility for benefits on receipt of assigned authorization prior to a person's enrollment in the plan, or it can be non-conditional, which is much more common these days, where eligibility cannot be conditioned on the receipt of assigned authorization. Conditional authorizations, by the way, are very rare in the group health market following the exclusion of pre-existing conditions and other market reforms, but can still be seen in some cases for underwriting and risk rating determinations. Another common activity of HR professionals working on behalf of their group health plan is assisting employees with claim or benefit issues. So here, how many of you are raising your hands to this right now? I'll bet this is a pretty popular item. Well, just how far into PHI and authorization requirements this goes will depend, of course, on the situation. Usually, if the employee is right there with you on the phone and you can resolve the issue with a conversation, nothing further is needed because you've got their permission right then and there. However, if you venture into written communication with the TPA or carrier, you'll typically be stepping outside of the summary health information realm and into that of PHI, for which a written authorization from the plan participant should be obtained. This is especially helpful if you are a fully insured plan and typically are not handling PHI. Now, earlier we touched on the need to keep disclosures to the minimum necessary to accomplish the task without over-disclosing PHI. For example, if you worked with canned reports from your TPA that come automatically with everything from soup to nuts, including things like claims details, and say your broker calls and asks for some aggregate stop-loss information, don't be tempted to just send that soup to nuts report with extra claim detail information on it as your response. As quick and easy as that might seem, just send the aggregate totals requested, which is the minimum necessary to accomplish the task. The exception to this would be if an authorization from a plan participant specifically outlines additional information that can be supplied to a provider or a vendor, for example. All right, I won't go into too much detail with this other than to point out that some states have stricter laws for some purposes that overlap with HIPAA, and thus you may need to comply with the stricter state law for things such as records retention, for example. All right, let's look at what's protected by the security rule, which again is much like the privacy rule, but relates now to the physical aspect of PHI, otherwise known as electronic PHI. Some common examples of ePHI are email, electronic treatment records, electronic claims, and things like X-rays and other imaging stored and shared online. The security standards exist to protect confidentiality, integrity, and availability of electronic PHI. Self-insured group health plans and other covered entities must perform a risk analysis and implement a risk management plan to protect electronic PHI from threats and vulnerabilities such as those from hackers and ransomware attacks. This rule applies not only to covered entities, but also to business associates, which Sonya will talk about shortly. Once you determine your organization is subject to the HIPAA security rule, you must run through a basic checklist of items, including the appointment and training of a security officer and staff that will assist in the implementation of your HIPAA security, the performance of a risk assessment of your organization's ePHI handling, and development of a risk mitigation plan and policies and procedures to safeguard ePHI, staff training on policies and procedures, and of course, ongoing monitoring and periodic evaluation of your systems to ensure their integrity. As issues are found, correct them, rinse, and repeat. With PHI and ePHI, the need to secure it increases with the environment. The more places it travels, gets stored, and gets accessed, the higher the need for increased security. The security rule identifies administrative safeguards as actions you take and maintain to protect ePHI to manage your workforce's conduct in relation to its protection. There are 9 basic standards for administrative safeguards. Some of them you will readily recognize, such as the assignment of a security officer, routine and frequent security awareness trainings, internal audits to review risks, contingency plans in case of emergency, and procedures for reporting security incidents. PHI recipients should have a privacy officer assigned, contracts with each business associate, known as a Business Associate Agreement or BAA, forms and documents to support individual rights for the safeguarding of PHI, policies, procedures, and systems in place for the protection of PHI, staff training with relative frequency, and privacy complaint processes and appropriate sanctions. In addition to administrative safeguards, physical safeguards must also be in place to ensure that electronic PHI is protected from both natural hazards and unauthorized access. This pertains to access to facilities, workstations, and devices and other media, such as phones and flash drives. Some common examples of physical safeguards are the maintenance of computer servers in locked rooms, screensavers and locks after a designated number of minutes, door badges, and the shredding and disposal of PHI records. In addition to physical safeguards, there are technical safeguards that employ technology to protect ePHI and help control access to it. Some examples of technical safeguards are the use of usernames and passwords and the frequent changing of them, as we know, firewalls, data encryption, and the remote wiping of phones and hard drives when devices are lost. All in all, the security rule is a federally mandated floor of protection based on three main principles: comprehensiveness, scalability, and technology neutrality. Comprehensive in that it addresses all aspects of security. This means that security measures address confidentiality, data integrity, and availability. Scalability assures that the security rule can be effectively implemented by covered entities of all types and sizes by calling for it to be reasonable and appropriate. You should be able to fit the security rule to your needs, whether you're a large or small covered entity, and the rule provides factors to be considered when determining which security measures are reasonable and appropriate. These factors are size, complexity, and capabilities, technical infrastructure, hardware and software security capabilities, cost of security measures, probability and criticality of potential risks to ePHI. However, one thing to note, the security rule cautions that the cost is not meant to free covered entities from the adequate security measures responsibility. And finally, technology neutral means that the security rule does not define specific technology requirements, and as such, covered entities can make use of evolving technologies as they become available to keep their security standards up to date. All right, I'm going to hand this over now to Sonya Gordon, who will provide an overview of the updates and additions the HIPAA HITECH Act added to the overall HIPAA picture for group health plans and their participants. Sonya?
Thank you very much, Lisa. Thank you, Corey. I wanted to go over a bit about the HITECH Act, which is definitely the largest amendment or extension of the HIPAA rules and regulations since they were put into place in 1986. So the HITECH Act stands for the Health Information Technology for Economic and Clinical Health Act of 2009, and that is a mouthful. I don't think I've said it, that whole thing in full since 2009. It was implemented as a part of former President Obama's economic recovery program at the time, intended, I think, both to incentivize healthcare providers and the clearinghouses and the like to both modernize and provide incentives for them to switch to electronic records, because at the time there's a relatively low percentage of providers doing what Lisa was describing, operating with electronic healthcare records yet. But at the same time, realizing that with this switch will come increased need to protect the privacy and security of those records. And even if we had those rules in place, they were going to need to modernize, and they needed to be extended to all parties who are dealing with this information. And that really pertains more to the business associates or parties that fit into the definition of business associate that Corey talked about earlier. Basically extending the liability for the privacy and security requirements that we've already discussed. Now they wouldn't apply just by contract to a third party or TPA. Now they apply directly to those parties. Namely, again, the privacy and security requirements will apply. Anyone that meets the definition of a business associate are now included under the HIPAA enforcement umbrella, and they would be subject to the same criminal and civil penalties for noncompliance that any covered entity actually would be in the first place. Another notable item is a subcontractor for a covered entity is also considered a business associate, and they are now strictly liable for what might be subject under a business associate contract. The other areas that are now extended to business associates through the HITECH Act are breach notification rules. Now, the breach issues that were brought up before with regard to HIPAA information There are now much more detailed steps and definitions to be mindful of in policies and procedures. Basically everything that Lisa was describing about administrative and physical and technical safeguards, the onus is now on those business associates and third parties to establish those safeguards directly as well. And on the other hand, the HITECH Act also expanded patient rights and access by allowing them to request their PHI not be disclosed to third parties for health plans or payers for payment if it's paid out of pocket or paid in full at the time of service. They also have rights to obtain copies of their own electronic health records or have them forwarded to a third party. They can also now request an accounting of the disclosures of their PHI that have been made. And it also establishes the prohibitions on the sale of PHI or electronic health records that may be sold to other marketing teams for marketing purposes. And at the same time, sort of what I alluded to before, some hospitals and professionals can qualify for Medicare and Medicaid payments if they adopt certain certified EHR technology to achieve those specified objectives in bringing their records into a more high-tech protected environment. Okay. Can we go to the next? Thank you. So this nice little tree sort of shows the different possible parties that may qualify or fall under the umbrella of a business associate. I mean, again, the definition as put out there by HHS is that a business associate is a person or entity that performs certain functions or activities on behalf of a covered entity that involves the use or disclosure of PHI and as part of providing their services to that covered entity. One thing to note is that an employee of a covered entity is not a business associate, just as, you know, the plan, the employer themselves may not necessarily be directly subject to HIPAA. That said, a health plan or provider can be a business associate of another covered entity. If we look at this diagram here, we see that different parties that may be performing such functions include clearly third-party administrators who may be receiving and using this PHI data for payment or healthcare operations, FSA or other cafeteria plan administrators, also auditors, lawyers, actuaries, or accountants, brokers such as Hub, other insurance agents that might be using this information on a limited level, and other vendors or consultants or COBRA administrators may all fall onto the category of a business associate. And as such, they're going to be required to have a business associate agreement in place, not just to cover the entity's liability, but as a matter of law under the HITECH Act. And one thing to note is that they're also stating that these entities may be performing certain functions or activities. While I'd say nearly all the parties listed here are most likely just performing covered entity activities just as a part of their primary functions, some may not necessarily be doing so depending on the nature of their work. So HHS does include some examples of those functions or activities in the HITECH Act laws. They can include areas such as healthcare operations, claims processing or administration, data analysis, processing or administration, utilization review, quality assurance, billing, or other benefit management or practice management activities. So if the activities that the vendor or individual is performing isn't falling under that those categories with regard to the health information, they may not necessarily be a business associate. Now, again, one thing to keep in mind is as a part of the requirements of the HITECH Act, the business associate agreement, which is the contract between the associate and the covered entities, is now required by law to be in place. And what the law states is, I find this a little bit deliberately vague, is the covered entity needs to receive satisfactory assurances from the BA that their protected health information will remain protected as required under HIPAA. But what they're saying basically is that to get that satisfactory assurance, that must be encapsulated in the form of a written contract that's encapsulating what they will and will not do with the protected health information. Now, a couple things I just wanted to say about the contract itself. While those are often very detailed documents, and there are actually decent prototypes out there, including on HHS's own site, the main idea is that the contract between the two parties would describe the permitted uses of the PHI by the business associate and by the covered entity. It will also provide that the business associate is not going to use or further disclose the PHI other than as permitted or required. And also it requires by contract that the BA take the appropriate safeguards, as Lisa outlined, to prevent any uses or disclosures of PHI other than as provided. And then also includes the reporting obligations that I'll get into a little more detail later on. And it also sort of speaks to the additional liability on the two areas that Lisa was mentioning before, sort of like we're back at the heads and tails side of HIPAA, now extending also to business associates. They need to pay attention, as I said, to uses of disclosures that are not permitted under their own contract, the minimum necessary disclosure requirements, the breach notification requirements, providing any records or requested copies of the PHI in the electronic health record format. They're also directly responsible to HHS in the event of any audit or investigation for any breaches on their part, providing accounting disclosures for employees upon request, and creating possibly additional BA agreements with their own subcontractors, as they would fall under the same umbrella of being a business associate. And as I said, the HIPAA security rules would also extend to them directly through the establishment of the law and the agreement as required under that law. Now, one area that is become, kind of headlines grabbing and, very frequently seen lately are cybersecurity incidents with regards to PHI. To their credit, HHS seemed to want to tackle this problem head on, but that hasn't prevented the problems from happening. That said, they have created quite a few resources that are quite helpful towards this end, namely the OCR quick response checklist in the event that a business associate or a covered entity realizes that there may have been a cyber-related security incident for one reason or another. In short, as outlined below, it says very plainly that the entities must take 4 steps. The first is to execute a response and mitigation procedures and a contingency plan. In short, they need to stop this incident from continuing to happen. And also they need to report the incident or possible incident to law enforcement if it applies. Report threat indicators to other information and analysis organizations, and also follow the HITECH Act's breach notification requirements where applicable. Now, one thing that this act also established is what exactly meets the definition of a data breach. One thing to bear in mind is that this is the unpermissible use or disclosure of unsecured PHI. Sort of similar to what Corey was talking about with personal information versus just the individual information. This information is only going to be considered a breach if it was unsecured. So for the most part, this is going to be assumed to be a breach unless the covered entity or the business associate can show or demonstrate, or at least knows there's a low probability that the PHI was actually unsecured based on the risk assessment or based on their ability to show that the data itself remains secured despite it possibly being disclosed to the wrong party or for the wrong reason. To that end, under the HITECH Act, unsecured PHI is considered public health, protected health information that is usable or readable or decipherable to unauthorized persons through the use of technology or methodology. Now, the other thing to note with regard to doing the breach analysis is the discovery of the breach. There are different ways in which a breach might be treated as discovered. The most obvious is just simply on the first day the breach is known to the covered entity, that is considered discovered. That is very straightforward and there's really no way around that. However, there's also, in lieu of that, in the exercise of reasonable diligence when the breach was known or should have been known to the covered entity. So if the covered entity had been doing its job, when should they have found out about this breach one way or another? And from that point, the notification time to let the relevant parties know that a breach occurred begins when the organization knew or should have known that that breach occurred. And that time period is, for, in short, 60 days. From there, we also need to assess whether this really was a data breach. These are other areas that can add to the work, but are worth doing in order to determine whether additional steps are needed. So one thing you want to look at is the nature and the extent of the PHI that was involved in the disclosure. Was it used in a manner that was adverse to the individual or their interests? Was it considered, fully PHI, or was it areas where identifiers were, say, protected, redacted, or somehow impossible to detect? You also want to notice if the identity of the unauthorized user or recipient, was it someone working within the capacity, for example, of the business associate company? If it was someone working for the company who wasn't supposed to receive the information, but knows they shouldn't have received the information, it's possible that with the proper due diligence, you can establish that no further disclosures or unauthorized disclosures will occur as a result of this initial disclosure. You'd also want to look at whether the PHI was actually acquired by the unauthorized party or actually viewed by the unauthorized party. So the example that we look at most, of course, is a stolen laptop, because that tends to be how this information is getting disclosed in unauthorized ways. But it's possible that stolen laptop could not be hacked into, or the password, was strong enough that it wasn't used, for example. So it's entirely possible that despite the unauthorized, receipt of the information, they might not have actually seen it. And same goes for working within, more legal capacity. If the third party working for the clearinghouse or the TPA received it, but said, "Oh, I know that's a security file that I shouldn't touch," let somebody know, didn't look at it, deleted it and deleted their deleted file, it's possible that you can conclude that the PHI was not actually acquired. Well, it was acquired, but it wasn't viewed. And last, you would want to look at the extent to which the risk has been mitigated. What we were talking about before, did the recipient take the right steps? Have they verified that they did not see it or they will not do anything further with the data? And in the example given here, did the recipient sign a confidentiality statement, which I would say would probably be the best reassurance, at least for the employee of a business associate, to assure that they have done their due diligence in this. But what is important to bear, I'm sorry, actually, could you go back to that slide just for one more second? Thank you. But in short, what's important to note is that the burden is on the covered entity or the BA to prove that they took all the steps necessary to show that this is a low probability of the PHI being compromised if no notification is made. Essentially, if they do not notify the proper parties of the unauthorized disclosure, they need to show they have the backing to say this is why we didn't do so. And for example, if there's no breach notification required for an unauthorized disclosure, if the PHI was encrypted in accordance with the HITECH Act's own guidance. I mean, that's kind of a given, but that's sort of a nice one to keep in mind. Okay, thank you. So breach notification, if you've gone all through this and you've determined that this was a security breach and a notification is required, is also pretty painstaking and has a few steps to it, but can be done. What the BA or covered entity is going to want to do is notify each affected individual by first-class mail or email if the email method has been approved through the party through the electronic disclosures requirements. And that notification is going to need to include certain information. Some of it's fairly straightforward: date of the breach, date of discovery, the type of personal health information involved, the circumstances of the breach, how did this happen, the steps that the individual should take to protect themselves, but also the steps that the covered entity or BA is taking to mitigate or reverse whatever harm may happen and to protect against any future breaches. Also note that it's possible that public posting of the breach may be required if the recipient contact information is not available, and if the breach affects more than 10 individuals, in which case it would need to be posted for 90 or more days. Excuse me. But note again that the notice needs to be provided without unreasonable delay, but no later than 60 days from discovery, as we discussed earlier. And once again, the burden is on the covered entity or the business associate to prove that they made all the required notifications and provided all the required information in those notifications, or to prove that they were not required to do so. Now, one thing that is also worth noting is that notification, reporting, and publication also has additional steps for larger groups. If this is a breach involving 500 or more individuals, and unfortunately, lots of times they are, the group is going to have the obligation of submitting a report to the Secretary of HHS immediately. They will also need to create a public posting regarding the breach, announcing what had occurred on the HHS website. And unfortunately, they may need to also alert local media if those affected by the breach reside in the same area, in which case media outlets will sometimes have to decide whether they're going to cover it, especially if it's all in a concentrated area that might be considered reportable information, depending on when and what information is sent by the covered entity or the BA to the press. Now, if the breach involves fewer than 500 individuals, in that case, the HHS report is not required as a matter of law, but the covered entity or BA is going to need to maintain a log of such breaches as they occur and annually submit them to HHS. Hopefully that log will have like one breach total, but that doesn't necessarily mean that will be the case. So the BA or covered entity will need to also notify possibly the Federal Trade Commission of any breaches that may have occurred as a result of any products or services that are approved by the FTC as well. The BA obviously will need to report any breaches to the covered entity directly, and also state what mitigation is needed and to what extent possible it will be needed to reduce or eliminate the harm caused by the breach. So last, I just wanted to touch on a few breaches that have made headlines lately. I mean, this could take up, another 30 minutes of the presentation, but we kind of narrowed it down to the most egregious or most creative ones here that, you are free to look at your leisure. One was a $2.3 million fine assessed to a medical group that failed to take appropriate security measures and had their patient records accessed by a hacker, as well as disclosing the PHI to other third-party vendors without a business associate agreement in place. Another much smaller penalty, but no less egregious, of $100,000 was assessed against a company that had moved locations, and they moved the storage of their medical records, but they allowed over 2,000 records in paper to be at an unsecured facility before they were shredded, which also permitted the disclosure of that information sitting on paper. Another big one, $4.8 million for a hospital error where the health records of over 6,000 patients ended up online and searchable. You can see why that was a much bigger fine, because that was much easier to find and on a much larger scale. And a $250,000 fine for a health insurance provider that had an unencrypted laptop containing other electronic PHI of 150 individuals, which was stolen from an employee's car. Now, this last example seems to be the story that I find I'm hearing the most, the encrypted laptop that is sitting unattended, left in plain view, basically every problematic way to leave your car nowadays. But unfortunately, this is this one that we see happening the most, and I would say would probably be the most preventable as well. So I would strongly suggest that groups that are assigning laptops to their employees that might have this information take stronger steps about how those laptops are stored, when they're taking them to and from the office, and how to access that information. Now, with all that fun information in mind, I'm going to turn it back to Corey for some key takeaways from the different areas that we covered today.
Thank you, Sonia. So with this, we have a number of takeaways that we just want to highlight overall. So first and foremost, understand whether or not your plan has access to PHI or not. If it does, of course, that's going to increase your compliance requirements. And remember too that this also means that even though you might not regularly receive PHI, it's just the mere act of being able to have access to it that is going to trigger these compliance obligations. Where applicable, make sure that you have your policies and procedures in place, and of course, name your privacy and security officers. These are going to be those individuals that are overall responsible for the privacy or security of HIPAA actually within the entire organization. Sometimes employers ask us who should be their privacy officer or their security officer, and the answer is that it depends. It depends on the organization. I know sometimes where the privacy officer might be an attorney, and the security officer might be someone from IT. That being said, there's no one-size-fits-all approach. I've also seen where it's someone from HR or the benefits team that acts in one or both of those capacities. Recognize that HIPAA compliance requires an ongoing commitment. This is not something like filing a 5500. It is not a one and done. It does require an ongoing commitment. Of course, some of these things like making sure that you have policies and procedures in place or naming security officers aren't necessarily things that you need to necessarily revisit very often, but this is absolutely not a one and done type requirement. Remember also that your HIPAA compliance obligations increase with your degree of self-administration or the hands-on handling of PHI. So the more PHI you get, the more required information you are required to protect. Also, think about things like COBRA administration that you could possibly outsource if you wanted to. If you're handling that internally, obviously your overall level of responsibility is going to increase as opposed to being able to, say, outsource that over to a COBRA administration vendor. So anything that you're handling internally related to PHI is then, of course, going to increase your required responsibilities. The HIPAA security rule is absolutely scalable. So it's not necessarily meant to be, again, you must buy this particular software or you must engage this particular vendor. Essentially, the Office of Civil Rights recognizes that organizations differ. So an employer with, say, 300 employees and a self-funded health plan is going to have much lower amounts of PHI than, say, a hospital system with hundreds, if not thousands, of patients. So because of this, obviously, it's reasonable. It's designed to not be a one-size-fits-all approach. They recognize that cost is going to certainly be a barrier for, again, that employer that might have 300 employees as compared to that hospital system with, thousands and thousands of patients. HIPAA compliance is no longer a contractual requirement per se, but it is a strict requirement under the HITECH Act. This really relates to the business associates. So remember, it's not just, oh, you failed to comply with the contract. Failing to comply with the contract relates ultimately back to the HITECH Act and the law itself. And then finally, covered entities and business associates have to establish their own internal policies and procedures to address the new breach notification rules, deadlines, and exceptions to those rules. To this, I will also add the importance of understanding the breach notification rules and recognizing, as Sonya highlighted, what is and what is not a breach. Sometimes there's a tendency to automatically kind of define anything as a breach, even though it might not actually be a breach. To that point, it really makes sense to go back to the definition of what actually is a breach and then follow those breach notification steps if it truly was actually a breach or not. That essentially brings us to an end. So with that, I'd like to thank all of you for taking the time out of your day to attend today's presentation. I hope you found this information available. For more information and resources, please visit us at www.hubinternational.com. Thank you.
Thanks, everyone.
Thank you.